All right, so good evening to most of you, maybe good morning to some of you. My name is Matt Austin, and I am one of the co-directors of the OPAL MAS program in Patient Safety and Healthcare Quality. I'm delighted this evening to have two of my colleagues join us, Drs. Albert Wu and Paula Kent, and I'm going to ask them to quickly introduce themselves and maybe say a little bit about themselves. So Dr. Wu, would you like to go first?
Sure. I am Albert Wu. I'm an internal medicine physician. I used to be an AIDS doctor, but now I'm mostly a GP or a primary care doc anyway. And I'm a professor of health policy and management, and I play an administrative role in our Armstrong Institute for Patient Safety. And I'm also the director of this master's degree program. These days, I'm very interested, besides bread and butter patient safety, I'm very interested in also keeping healthcare workers safe and preserving their well-being so that they can do a good job.
Wonderful. Thanks, Albert. Paula, would you like to go next?
Sure. Well, welcome, everyone. My name is Paula Kent. I am a nurse by background. Got a couple of graduate degrees in nursing administration and the MBA from Hopkins, and then went back to school to get a doctorate in public health from Bloomberg, where I currently teach a Term 2 class course on Intro to Quality of Care for Practitioners. My current role includes that faculty role at the School of Public Health. I'm an advisor with Dr. Austin under Dr. Wu's program at the School of Public Health, and I teach at the School of Nursing, and I'm a patient safety specialist with the Johns Hopkins Armstrong Institute for Patient Safety and Quality. And there I lead a Team Steps program, along with conducting some international work with our affiliate hospitals and certain contracts. We're currently administering a safety culture assessment in one of our affiliate hospitals in Saudi Arabia. And I'll be supporting their conference next month in Saudi as well. So I have a broad interest in patient safety. I've been working in the field for probably about 20 years now. And I'll stop there because I could probably talk all day about patient safety, but we're here to hear how we can support you in your journey.
Thanks so much, Paula. Just a little more about myself before I introduce our esteemed guest and eventually guests for the evening. So just to give you a little more context about myself, I'm actually on the faculty here at the Armstrong Institute for Patient Safety and Quality. I'm an engineer by training. I actually worked in the airline industry for about 12 years prior to coming over to healthcare. And I focus in on performance measurement in safety. So as I like to say, I like to spend my days nominators, which is make people want to talk. Very interesting. Measuring diagnosis and how we can measure diagnostic excellence. So that's been sort of an area of focus as of late.
Matt, some of your audio is fading out with the competing audio from, thank you.
Yep, thank you, David. So we're going to first introduce Carolyn, and then when David is able to get home, we'll have him join us as well. So Carolyn, I'm going to ask you to introduce yourself, and then I have some questions I want to ask of you about your experience with the program and time with the program.
Sure. It's nice to meet you all this evening. My name is Carolyn. I have a little bit of a different background. I am a registered veterinary technician. And so that is veterinary medicine is everything to me. I work for a large veterinary corporation that has over 1,000 hospitals across the country, the US and in Canada. And I really got interested in patient safety before I knew what patient safety really was. It is something that's just getting started really in veterinary medicine. So we don't have the same sort of systems that exist for reporting and things like that that human medicine does. But it's exciting and I've learned so much. And it's something that we're actually bringing to veterinary medicine. So even with a diverse background, this program I'm in the home stretch. I'm in my last term, but there's just so much to learn about patients regardless of species and how we can really affect healthcare quality and looking at One Health too. We're all connected somehow. So it's been a great learning opportunity for me over the last couple of years.
Wonderful. Thanks for sharing that sort of background on yourself. I mean, I think what's been really fun for me as someone who's involved in the program is we've had folks from veterinary medicine, we've had folks from human medicine, we've had a fair number of folks from the dental world who've been part of the program. And so I've really been encouraged and maybe slightly surprised by the various sort of fields that the program has attracted, and I think it's been a really rich experience for us to all sort of learn from each other. So Carolyn, I think my first question for you, just to sort of set the stage for the group, is so what drew you to this program? So as you were, looking at programs 2, 3, 4 years ago, what was appealing about this program to you?
So a couple things. My former boss, Rochelle Lowe, had gone through this program and a couple years before, and she had just started saying, like, what do you think about this? She was talking about team steps and just even the RISE program. And she was like, how do you think this could actually apply to veterinary medicine? And so we started to think about patient safety, and we have brachycephalics and how do we manage their care and just kind of getting the conversation started. And then truly, I was lucky enough to meet Paula. We started working on team steps as a communication, like all of the different tools that exist for it for veterinary medicine, and really going, I believe in this. I think this is such a huge need in how we communicate with one another to keep each other safe, to keep our patients safe, and really just seeing that there was so much alignment in veterinary medicine to human medicine. And when I looked at the program, I work full-time, more than full-time, and I have to travel a lot, and looking at the program curriculum and going, this is really opening a world of perspective to me, something I hadn't really seen before. And not going to lie, super intimidated. Even in the first classes, there were lots of people with lots of letters and just kind of, and the fact that it was global, seeing things that I would not normally see within my environment was very attractive to me because we can only learn more from each other. And that's really what it was. It was something that was flexible enough for me to be able to do full time. I'm also a mom. And then to be able to have the diverse kind of aspects of the curriculum to be able to apply to my current job.
Great. So for those so team steps, what is that? Can you just sort of explain that for those of us who don't know what that is?
Oh, there's pressure because there's Paula's on the line. No, but Team Steps is a group of different tools for communication. It started with AHRQ, the Department of Defense, and really it's just a structured way to communicate with one another to make sure that we are communicating efficiently and effectively and in the proper tone, really, when we have certain points that we need to get across, because in any healthcare environment it's complex, and so having sort of some key aspects of reminding us on how to communicate, like a cuss tool, that we want to say we're concerned, like that's like our flair to go, please pay attention to me, this is important. And so it's a whole suite of different tools that you can use for communication in the healthcare space, but also, like I said, it was started at the Department of Defense. So it can be used in lots of different settings, but we need concise communication in different environments. And so it's just been such a gift. It aids in the culture of safety in the hospital. So you can be transparent. You can, when you mess up, you admit it and you're not afraid to do that. And it goes through different tools again, just to be honest and transparent so that we can all do better and really focus on the safety of the patient. We mess up, that's fine. Don't hide it. Just be really authentic and let's kind of get through it together. And so there's a lot of good stuff out there for that.
Wonderful. And Dr. Kent gave you big kudos in the chat for explaining.
He's very kind.
We'll have to have you on the Team Steps tour. So Carolyn, what have you liked about the program? What has been?
I've liked that I've been challenged. I've liked that it started off like kind of slow. I was like, okay, I can get this, a little bit about public health, really looking at the environment around you to kind of level set, so that you don't just drive into, well, I want to learn all about, patient safety, or I want to learn about quality indicators. It started going like, take a walk in your own neighborhood and see how public health can affect you. And so it was just a really good foundation skill for me, just to kind of take a deep breath and look at how we can all be impacted. And then there's also the One Health courses. But I think as we've gone through, what I've really appreciated is the diversity in the curriculum, statistics and all the fun stuff, epidemiology, just kind of, again, just seeing how the different components work collaboratively and cohesively together. And I've loved the camaraderie that you get with the individuals that you go through all these courses. Again, like I said, not everyone is from, Baltimore. You get all different countries and you have no concept, at least I didn't. I had no idea the different things that they ran into, whether you're in Africa or you're in Haiti or whether you're in Canada. And the diverse perspectives, again, make you want to appreciate where you're at, but also go, we can do better. We know more. And I feel like that's been a gift. I like too that there's a lot of discussion forums because everybody's on a different time zone, but just the discussion back and forth, asking the questions, getting to know each other over those discussion boards and being vulnerable enough to ask like the question and everybody going, thank you, because I didn't know that either. I've never met them in person, but it's just been, you still feel like you're part of a group that's going through this together. And I've really appreciated that.
Yeah, that's wonderful. And what have you found useful about what you've learned?
Well, a couple different things.
Or about, you haven't learned anything useful, but maybe you have, yeah.
No, I have. I've learned a lot of different things. Use your resources. Don't be use your network. Those things have definitely helped. I've learned a ton. Like I was really walking into this open and curious, and as far as different resources that exist out there, to go ahead and even do measures. Like we didn't really have that in veterinary medicine. So understanding that, I feel like there's just been, again, writing papers again. It's been a minute since I've been in college. So going through and working through those things together. But I think one of the tools that Paula gave me right before we even started was they have office hours for a reason, use them. And so to be successful in the class, even if you're just there to listen to other people's questions, I feel like that's something I learned was you go to school because you don't know the answers. Be open to hearing the conversations. And that's just been something that I've even applied in my current position, is just having office hours, talking about conversations together, because you never know what's going to come from it. So that's been something that that for the first term I was nervous about, but Paula kept just encouraging me to not be shy about it, and that's been a big lesson that I've learned.
Yeah, super. Well, Paula's a great cheerleader to keep people going through the program, so that's great. David, are you at a point where you're able to chime in a safe way?
I'm still driving. Actually, what I can do is I'll pull off the road and I can certainly try to answer any questions or anything for anybody. So
Yeah, so let's
I stop. I'll turn on my
figure out
camera. Hang on, Matt.
you. Yeah, so let's figure out what's safe for you. And maybe in the interim, we can see if there's any questions from our future folks, future colleagues as part of the Masters of Applied Science program. So are there any questions from folks, either for Carolyn or for David or for Dr. Wu or Dr. Kent or myself? Morgan, if you have questions about admissions. Yeah, Marcia, please jump in.
Yes, I thank you so much, Carolyn. That was really wonderful. And I know that there's a strong emphasis on clinician because it's patient safety. There's that level of interaction. So could anybody highlight how those of us who are not clinicians, how this is very much relevant, at least the second part? I know that it's quality improvement, quality care. So is there anybody that can actually share a little bit more about that for those who are not clinicians?
I
Dr.
can
Wu,
add.
you
Sorry,
want-
go ahead.
Anybody, go ahead. I was gonna.
Oh, it's David. So um, I, I was listening to Carolyn as she was speaking, and I'm a clinician, but I will tell you that, and my exposure has been somewhat limited because I'm only in the third term in the first year, so I haven't gone through the whole program yet. But just the exposure that I've had so far, um, uh, I, I will tell you the things that you sort of just take for granted, but basically because of the courses, I just finished this writing course, and writing has always been a weakness of mine. And so whether you're clinical or not clinical, because writing is so important to communication, I mean, this was really eye-opening for me. And I really appreciated having to do this. Even though when I saw it on the curriculum, I thought, okay, that's going to be interesting, but really wasn't enthusiastic about it. But as I got into it and went through it, it became something that I recognized that I really need to improve on, regardless of what happens in my future career. And then as a clinician, I'm not that into quote unquote public health per se, because of my own specialty, but the One Health was really interesting, and understanding the interactions between animals and the environment and health, again too, was very illuminating. So that would be the things that come to mind in response to the question.
Marcia, I'll chime in too. Because one of the things that the whole program really emphasizes is giving people a set of new lenses, a new sort of special vision, so that you can see that things that don't work well or things that sometimes do work well are all parts of systems. And if you can see with system lenses, you can understand a lot of things better. And it can also help you overcome a bias that we all have. We all tend to be pretty critical and see people when things go wrong. But in healthcare and in a whole lot of other things, there are lots of other factors that make it easier or harder to do the right thing and easier or harder to be successful. And so that is one sort of way to think and way to see and way to analyze things. There are other models that we try to use, sort of models for communicating better. So you've heard about. On the on the side I direct a nonprofit, which is a network of about 40 community-based social service organizations in East Baltimore. And we are now starting to apply some of the things that we do in patient safety and quality to the way they work. One thing that is very helpful is that we are working with their workers in the same way that in patient safety, we are spending a lot of time working with workers, with nurses and doctors and pharmacists and technicians, and then all sorts of other people, actually. And something I had a conversation with someone who Carolyn might know, but who is a director of internal medicine for a big chain of veterinary hospitals. And we were talking for a while, and after a minute, I said, "You know something? We are very, very similar. We are both internal medicine specialists. The only difference is that your patients have more legs than mine do, and maybe more fur. But our patients are a little different. But a lot of the work that we do with clients, with patients, with other people is very similar. And I think that I'm not 100% sure how this would fit your focus, but I think that there are quite a lot of lessons that cross over.
I think too, honestly, Marcia, like there's they kind of meet you where you're at. Like I'm not a clinician. Human medicine is hard. Like some of the topics that have come up, I'm, just being really transparent. I've had to read more probably than other people in the class because I had no idea what they were talking about. But you get to pick your topics for a lot of the papers. And so like some of them have been things in my own life. Like I think of, my kids and something that I'm like, okay, this is relevant to me. And then you can go ahead and find the papers and they help kind of guide you through going, all right, well, this makes sense. This aspect of it makes sense. I'm not trying to figure out medications and things, but like what part of this, like what Dr. Wu just said with the system, like what possibly could be broken within the system. And then you find the thing you're passionate about, and then you can write like tons of stuff on it. So it isn't anything I have not found that it's so limiting or prescriptive that I can't see myself in any of the topics. And then I can kind of choose my own direction. Now, sometimes it's a stretch. Like I have to do a lot of pediatric things because that probably relates most closely to veterinary medicine because we don't have a lot of the same studies out there. But you usually can find a path. And if you talk to your professor, they're really supportive in getting you there.
And if you allow me, Alexander, I just had one follow-up question or just clarification. I just wanted to make sure, I do believe there's a final project attached to you applying a lot of the patient safety and quality improvements. So I wanted to make sure that I would actually be able to do that because I focus more on primary prevention and I work with just system in like non-traditional setting, and I work for a nursing school. So it's just a little different, but it sounds like it's very much applicable. And because it's global, we're having different conversation that would allow, I guess, my project to actually come to fruition. So it sounds great. Thank you.
Yeah, sure. Alex, I won't call you Alexander this time.
No, I appreciate that. Yeah, no. So Carolyn, I appreciate you sharing that story. I mean, the first thing that I came into this when I first looked at these programs at Johns Hopkins, I was wondering, I was like, oh man, I'm gonna attend a program that's nothing but internal medicine physicians, and I get to ask those strange questions that they may already know. But healthcare is a very diverse like community. It's a whole, so many different aspects of this, and I work with flight nurses and flight paramedics all the time. So it was really encouraging to hear that there's such a diverse like interest in this program from different folks. And it's also, Carolyn, I really appreciate you kind of talking about, working more than full time. Like I think at this point it's 2024. I think most of us can probably admit that we're working more than full time, trying to get things done, right? So it's just like going to a graduate program, another graduate program, especially one at Johns Hopkins. It's like, okay, what is this pack I'm about to put on my back? I think I wanted to, I guess, clarify. So you actually started talking about something I wanted to ask that question specifically about, and it was the tailoring of these subjects that can help someone in their position as they're going through. Because 2 years of a program a lot happens in 2 years, especially how healthcare can change, and especially when I'm talking, primarily like flight medicine, for example, where I work. And it's just this idea of how there is built-in not flexibility, built-in adaptability to as the landscape of healthcare continues to evolve, coming out of the pandemic or out of the pandemic, and moving in this new direction about how we can take this information and continue to kind of find these like fun subjects that we're just like, all right, this is really affecting my industry in healthcare right now. I really want to take this class and really study and write papers about it and take the academic setting. So I'm more posing this as kind of like a clarification or discussion question of just like with all that in mind, with your experience as a vet tech, which has been really great to hear that there's such a diversity with this, is have you found with a lot of subjects that a lot of these classes you're going through that you can kind of keep that continuum of like, hey, as a vet tech or as my personal life or projects I want to be involved in the future, each class I can usually find ways to tailor that or get some of the folks who are teaching like, hey, this is my experience, like teach me in this direction while also still gaining all that background knowledge. I don't know if that's a very clear question. I apologize. I tend to talk a lot.
No. I think it does make sense. I think the papers that I wrote at the very beginning were like in one lens, right? Like the first one I wrote was about it was for patient safety and it was about medication errors. And so I could apply that to however that worked. And I chose I took insulin because imagine that people mess up insulin. And so if I think if I'm answering your question right now, 2 years later, the thing that I'm looking at is not the actual like pushing the plunger for insulin. I'm looking at the distractions that impact me at point of care to mess up that medication, right? Like what are people asking me? What's happening between when I go ahead and get the order for a medication to when I'm actually delivering it? And I think that's what it is like you can start with a concept and then go, but wait, now which way does it go? And I think and I wouldn't have even thought of that, like interruptions being a thing, except we started talking about those in groups and like, well, how many times your patient ratios or how many times do you get pulled in different directions with short staff? And we've seen that since the pandemic, everyone, how your tasks are diversified, how people get paged and contacted, those kind of things. So what I've been able to kind of learn and really by the group is starting to think differently and moving it forward. So like it's never like you're done. Well, now we've just figured it all out because that'll never happen. But it's been able to keep me moving forward to go, okay, well, what's next? What's next? How can I build on this? Or how can I think of it differently? And for us, even with insulin administration, now we're doing things where we can do blood tests on patients similar to humans, where we're not having to poke them all the time. And so just kind of thinking of that system approach differently or how you educate clients in taking care of their patient. For me, it keeps me motivated to know that there's more out there. And again, there's more good work to do. So I don't know if that answers your question, Alex, but I think it just keeps moving the needle forward. And I think sometimes then all of a sudden you realize your dashboard needs to change. It's not even what's in front of you. Like you have to look somewhere totally different to make an impact and see how you can affect, whether it's human medicine, public health, or veterinary medicine.
I appreciate that. Yeah, I mean that essentially kind of just gives it's a lot of like prediction of needing to be flexible in the future. I think that's where I'm at right now. It's like I know in a year or 2 years it's going to be like I just need to adjust. Yeah, the company I'm with right now is huge push for higher reliability, and it's just like I know that there's going to be project after project after project moving forward. So there's this almost excitement about hey, coming into ESA class and just be like, oh, cool, like I get to take this new project and also still learning this and kind of keep developing those lenses. So I appreciate you kind of explaining that. And again, I super encouraged that there's a diversity and interest in patient safety. That's something that I think for a long time, like we desperately need, especially coming out of the pandemic. Just finding that folks. So thank you, Caroline. I appreciate that.
No, absolutely.
Much. Jamie, do you have a question or a comment?
Yes. So probably maybe more for Carolyn, but for everyone as well. You just mentioned all these amazing interventions and work that you guys have been doing, in the vet setting and things like that. But would you say overall, folks coming out of this program, are you building like a really strong like research skill set? Because it sounds like so many students are doing wonderful work and implementing these very cutting edge like QI initiatives as what they're learning through the program. And, obviously learning from faculty who have also contributed to the field through publications. Do you feel like, you're coming through the program, have you built skills that you think you'll be able to take things from practice to publication? Because, as awesome as it is to be able to improve things at the bedside, also the larger contribution of sharing that knowledge.
I do. I haven't written, I actually started writing papers within this 2 years because it wasn't something I had ever tried before. And I feel like, one, you get acclimated to a lot of papers. There's a lot of papers to read, and how to actually read it appropriately and is it the right selection, right? Like when you start doing some of those studies. And even in this last class that I'm doing right now with measures, looking at a literature review, systematic reviews and all these, and that to me was completely foreign. And I was like, all right, I need to take a day and really think through this. So I think some of those, absolutely, those are skills that you do learn. I'm hoping to be able to publish a paper in the next year, and I think some of the core, and it's long, it's taken me a long time. I've done it in bite-sized chunks, but looking at, like, are the measures that I'm picking, are they the right measures? Are we, and it has to do with patient safety or quality culture of safety, sorry, as part of it. So it's like, are we even asking the right questions? And so it helps kind of pause you in your thinking to go, am I doing the right thing? And even now, like in the measurement class that I'm in, making sure you're looking at the right measurement. Are you asking the right questions, and is there validity and is there reliability to it? But I think it better prepares you for things like that. Now, putting it in practice and implementing and getting people on board enough to go ahead and try it out, that's a whole different thing. But structuring a paper in a thoughtful way, I think you get lots of feedback on it, and you get a lot of chances to see different styles and try it out. So I feel like for me, it's been helpful. I don't know what others think, but I felt like it was helpful for me.
Yeah, David, do you have a sense, now that you're sort of completing your first year, of whether you feel like this prepares you to do sort of research in this area, or?
So my comment about that would be, one of the things I recognized, and I didn't give you guys a good background, but I've been a maternal fetal medicine specialist for over 30 years. So I've been around a long time, and I've been doing patient safety and quality for 15 years. I attended my first IHI meeting, I think in like the mid 2000s. And that was the eye opener for me that made me recognize that this was an evolving science and specialty, and I wanted to be a part of it. And my decision to enter into this program really was to gain a set of tools that, even though I've been practically doing patient safety and quality for about 8 years, I needed to get better at it. And the program really attracted me because of sort of the non-clinical aspect. For me personally, I guess I come from this from a very different perspective than Caroline and a number of you, because I'm a clinician. I'm in the trenches each and every day. I'm living the patient safety and quality sort of issues that we see, and as a maternal fetal medicine specialist, the big thing is maternal mortality and maternal health, which has been in the news quite a bit because unfortunately, as a system, we're not doing a great job. But the things like leadership and the management of people, one of the things I've realized is that, yeah, you may have the knowledge and you may have the ideas about what you need to do, and the literature actually tells you, what the best practices are, but trying to get people and systems to move in the right direction, to incorporate this tool set is, to me, one of the most difficult aspects of patient safety and quality. And so I'm not that focused on research. I'm sort of towards the end of my career, so, but certainly for younger people, I can understand. I definitely think that the courses, when I look at the curriculum, will prepare people to do research and publish. But from my perspective, the things I wanted to do was sort of the management side of it, how to manage people and systems in order to make, I think, from that for me were the things that I was not very good at doing.
Yeah, thanks, David. Hey, Albert, are you able to speak to a little bit around the choice of making this a Master's of Applied Science and what that reflects in your mind? If you're able to.
Yeah, so we, on the one hand, we're Johns Hopkins, we could teach a course on doing patient safety research. But we thought that there was a little bit of a gap in the offerings, and that there were lots of people who were out working, doing things that related to safety and quality. And so many of them had been out working for some time, but never got the foundation and sort of all of the background that justified what they were doing. And so we decided we wanted to design something which would give people tools that they could then apply. Sometimes, sort of the week they learned them, but at other times, sort of eventually in their careers. One of the nicest things that I heard last year was one of our students was working at a Chicago Chicago pediatric hospital, and was working in patient safety, but didn't have a real healthcare background. And she was charged with looking at things that had gone wrong, incident reports, and trying to dissect them a little bit, trying to analyze what had gone wrong. And so we we have a session, we focus quite a lot on looking at a problem and taking it apart and trying to figure out where at many different levels of the system things might fail or where there might be weaknesses. And so we had some lectures, and we had an exercise, and we had a live talk about it. And she said the evening that she had that lecture, she then went to work, and she said it was sort of like magic. She actually knew the words to say and understood better how to take things apart. And she sort of within the next month, she actually got the job that she wanted to do, as opposed to just volunteering in this children's hospital. So she said, this couldn't have come at a better time.
Jamie, does that answer your question?
Yes, thank you all so much. I definitely appreciate the learning the tools on the fly. That definitely stands out, but also good to know that there are some, research skills to be gained as well.
And I think we've had a couple of folks join us since we did introductions at the start. I don't want to put them too much on the spot, but it looks like Shreya and Aster have joined us. So Shreya, are you able to unmute and introduce yourself? We would just love to know a little bit more about you and what your experience and interests are.
Yes. Hello, everybody. I've been listening. It's been really nice knowing all the programs. Actually, I'm interested in this program since last year. So I thought this is my opportunity to learn more about the program. My name is Shreya Triano, and I am a trained physician. I currently work as a performance improvement specialist in quality department at Huntington Healthcare in New Jersey. And yeah, so I'm in the quality world. So this program felt like, the best fit to me. It's my daily, it's something that I can learn a lot more and gain a knowledge to exceed in all of my projects every day.
Wonderful. Yeah, it sounds like you're living the world every day. Yeah.
Yeah.
So this is great.
Pretty much.
Sure.
Thank you.
Do you have Yeah, nice to meet you. Thanks for joining us tonight. Pastor, are you in a place to unmute and introduce yourself? Well, we'll try again before the.
Hello.
Oh, perfect.
Hi, good evening, everyone. So, I as well, I think I got into the program in March of 2020, but the same week I got into residency. So I had to defer the acceptance. But now the residency has been completed, and I'm navigating my first post-residency year. I know I definitely want to once again pursue patient safety and healthcare quality. I think I know a good amount about the program because, I've done a lot of research over the years on it, and also attended a few of the information sessions. But I'm definitely excited about what it has to offer come the fall semester. I think one of the things I'm particularly interested in is not just patient safety and healthcare quality, but also how I can have more of an entrepreneurial perspective to try to see how I can, exploit whatever I learned from the program to benefit hospital systems or just the healthcare system in general from a consultant perspective.
Wonderful. Well, I'm glad you came back to us, and I hope we're able to have you join us here in the near future. That would be wonderful. So thank you for joining us tonight. So just to be slightly mindful of time, we're getting up close to the end of our time together, so I just wanted to see if there's any, final questions, any other questions that are in folks' minds that we can help answer for you.
Cohort size, please.
Go ahead, Marcia.
Cohort size.
Cohort size. I will defer to Morgan and Albert on that question because I don't have those statistics myself. You're on mute, Albert, if you're...
Our cohort sizes have varied wildly. We do not have a target number of students. So we, because this is a practitioner's program, if anyone is generally interested, has a genuine interest in the topic, and can make a good case that they could do the work. And so, people need to have some qualifications, but that's, shouldn't be surprising. But we will accept them into the program. We've had classes that have been close to 100 people, but more recently, they've been closer to sort of 30 people. So it's not, however, you can do the program in 2 years or 3 years or 4 years. So you come into the class together, but you do not necessarily go through and march through in lockstep with all of those people. There'll be some people who graduate with you who in fact started 2 years before you. But they're taking, instead of 2 courses a quarter, they're taking 1 course a quarter and doing whatever else they're doing. There are many people who are very busy. Most of them are not in the middle of their residency training, but there are quite a few people who are actually doing fellowships. They've finished some of their basic training, and now they're getting some more time. They don't have to stay up all night every night. And so they're like, hey, I've got so much time. Why not get another degree? But many of those people don't go through it in 2 years.
Thank you. And one last question, any history of MPH folks coming, getting the MAS?
Oh, sure. Yeah. This is not, I would say that an MPH is quite a different degree. It's a little bit more academic. It is a credential, but I think it's also a literacy degree in public health. And there's a lot of things that go into it, even though we all love, One Health and planetary health and so forth. There are a lot of things that this program does not do. We're not that interested in environmental health, for example. We're not against it, but it's not, it's not what we really do. And so this is much more to provide usable skills in some field that benefits from, that focuses on improving safety and improving understanding and improving safety and quality.
Wonderful. I'm going to turn it over to Morgan just to provide you all with some reminders about key pieces of information, and then we'll, I think, officially wrap things up, but we can also stay on and answer questions if folks have those. So Morgan, I'm going to turn it over to you.
Thanks, Matt. So as you guys may know, we are currently accepting applications for the program. The official deadline to submit your application would be July 1st. I would say please do not wait until July 1st to submit your application. It always takes just a smidgen longer than most people assume, especially getting transcripts, letters of recommendation, things like that. If you're an international student, having your courses evaluated. For students who are interested in receiving a fee waiver to submit your application and SOFIS, costs about $145, but we are giving out fee waivers for students who submit their application by April 15th. So in about a couple of weeks, so give or take. And we can be a little lenient towards that as well. But all you have to do is start the application process. Once you get close and ready to submit your application, just shoot me an email saying, hey, Morgan, I would like an application fee waiver, and I will order it and hand it over to you. My email address is it's mshredder8@jh.edu. I think it's easier for me to chat.
Yeah, there you go. Thanks.
Yeah. So it's in the chat. So definitely feel free to shoot me an email if you have any questions about the application process or if you want to receive the application fee waiver. And we look forward to reviewing your application soon.
Yeah, thanks, Morgan. Morgan keeps us all in line with deadlines and making sure we're successful in getting this all executed. So thank you so much, Morgan, for your leadership on that. So I do want to say a special thanks to Carolyn and David for taking the time tonight to share with us and to share with all of you about your experience with the program and to answer questions. We feel very, very lucky to have both of you in the program, and we really appreciate you taking time out of your busy lives to do this for us. With that, we're at the top of the hour, so I do want to have people feel free to move on to other things in their days, but I'm happy to stay on and answer any follow-up questions that we can answer for the group. So with that, thanks to everyone, and we very, very much look forward to having you join us here at Johns Hopkins and the OPAL MAS Patient Safety and Healthcare Quality Program. So good night and good morning to all.
Appreciate it.
Good night, everyone.
Thanks for joining.